I'm Val Allen, Director of Perth Natural Medical Clinic, and I'm here today with Marie Hopkinson, our acupuncturist and traditional Chinese medicine doctor. So Marie, what started you on this journey of traditional Chinese medicine?
Yeah, look, that's a great question because lots of people ask me that, and when I was first studying Chinese medicine, I really had no idea, I guess, about what Chinese medicine was. And what got me first into it was just really the mystery of it. Like, it was something really unusual and interesting, different. I wanted to do some kind of medicine, but there wasn't really a lot of choices in Perth back at that time. And I just happened upon the course, and I wasn't really sure whether I wanted to do naturopathy or Chinese medicine. And I kind of enrolled in the Chinese medicine course, and then on the first day I was like, wow, this is exactly what I want to do. So it's kind of like, I don't know, just you know, those providence kind of things that happen.
I think so.
Yeah.
Sometimes other people know what we should be doing better than we do.
Yeah. So that was interesting, and then you know, that took me on the journey of going to China and like learning more about Chinese culture as well.
Oh, wow! So did you actually work in a China? Is it like an ordinary hospital in China? How does acupuncture work in China?
Yeah, well, they have a really different medical system there. So what they do is they'll have hospitals that are set up just for Chinese medicine, and where they'll integrate a little bit of Western medicine in there. They'll have hospitals that are just for Western medicine. At the time when I first studied Chinese medicine, that was back in 2001 when I went to China, the end of my course. The system there was you couldn't practice Chinese medicine or any kind of medicine outside of a hospital because it's like was part of the government regulations. Now that's changed a little bit now, and you've got a bit more private enterprise and stuff there. But they pretty much have a system there where they'll just have you've either got Western medicine or Chinese medicine. So they don't actually have physiotherapists or chiropractors or any other modalities there. So if you're sick, you're either going to use Western medicine or Chinese medicine. And so what you find is when you go to study Chinese medicine in a hospital there is the kinds of conditions that they will treat, like lots of things that would kind of go in a hospital that you wouldn't see here quite commonly. You know, you get to treat patients in the ward, like they've had surgery and then they're having treatment after that, stuff like that. It's quite amazing.
Wow, oh, that's amazing. So obviously most people are aware that acupuncture means needles, and some people are like, I don't really feel comfortable with needles, but it's not like a normal doctor's needle, is it?
Absolutely, yeah. Look, lots of my patients have that. I mean, I had someone yesterday that was quite scared of acupuncture, and it's very brave of people to kind of try to overcome that fear as well. But a lot of that's got to do with just your perception of what a needle is. So when you say the word needle, you think of a hypodermic needle, which is the kind of needle you get like as an injection into you. Now, actually, about 3 or 4 acupuncture needles can fit into the shaft of a hypodermic needle. So that's a good example of how tiny they are.
Right. Yeah. So, and when it actually goes in, the sensation. Well, I've had acupuncture, and to me, it's just like a little pinprick.
Yeah.
But if it seems to be on a point that's sensitive, I'm much more conscious of it.
Of course, yeah. Look, you can try this at home yourself. So what you do is you just can press along your hand, and if you just press along this bone here, so just along there, and as you press there, you'll find a spot that's really sore. Now that's a common point people use for headaches and things like that. Now that would be probably for most people one of the most sore spots on their body. So if you press that really, really hard and you feel like, in acupuncture we say you'll have like achy, tingly, numbness, heaviness, those kind of feelings.
Right.
That would be what acupuncture can feel like. Now, not every single point's going to feel that strong. Some points will feel heavy, some points will feel tingly. Some patients feel nothing at all. It can be very different, and even the more times you have it, the feelings you feel should change. But certainly shouldn't feel painful, like shouldn't feel uncomfortable.
Okay. Once the needles are in, it's not like a hypodermic that goes in and comes out. It stays in there for how long?
Yeah, look, that can change depending on what the treatment is. Sometimes we do put the needle in, stimulate it a little bit, which means get that feeling there and then just quickly take it out. But most commonly people have the needles, what we call retained, like stay in there for about 20 minutes. So you'll just lie there on the bed and relax, and that's a common thing people love to do. They just like relaxing because we don't do that very much in our society at the moment. So having 20 minutes in the middle of the day to just lie there and relax is beautiful.
It's good. Thanks, Marie. I found that really interesting. So if you think you can benefit from Marie's help, make an appointment, check us out on the website.